So there's a lot of disinformation floating around about ivermectin. Ivermectin, of course, is an anti-parasite drug that is used on livestock, dogs, as well as humans. There's a human version that is used to cure like river blindness and head lice and things like that. And so, look, it's effective at being an anti-parasitic, not so effective at fighting COVID-19. And yet, the right wing, and I cover this a lot in regards to the right wing pushing the drug for COVID-19, that has just not been proven to be effective against COVID-19. So with that in mind, corporate media has also fallen to a bit of its own disinformation about this. And so on September 6th, a local Oklahoma news outlet, KFOR-TV, reported that there were so many people in the state were overdosing on ivermectin that emergency rooms and ambulance services were backed up. According to the report, Dr. Jason McEllier said patients are packing his eastern and southeastern Oklahoma hospitals after taking ivermectin doses meant for a full-sized horse because they believed false claims the horse dewormer could fight COVID-19. The article then quotes McEllier saying, the ERs are so backed up that gunshot victims were having hard times getting to facilities where they can get definitive care and be treated. So you hear that and think, oh my God, the people are eating the horsey paste, and there's so many people eating the horsey paste that they are clogging up the entire medical system, and not even gunshot victims can get through. Well, before I get to the reality of the situation, multiple news outlets picked up this story. They ran with it. I looked at that and I was like, I don't know. Rolling Stone picked it up. The Guardian picked it up. Business Insider, MSNBC's Rachel Maddow also picked up the story. So now that said, is this something that's believable? Well, so look, have you seen our news cycle? Have you paid attention to the insane stuff that is actually true, that is actually going on? There's insane things going on all the time. I mean, just look at any story involving Florida man. It's kind of a phenomenon. And we are surrounded by so much information that sometimes it could be hard to parse out what's true, what's not, and what actually may be an embellishment of the truth, or not quite there, or drawing incorrect conclusions, or doing correlation between stories. There are issues like that. Okay, so now I think it's my job to kind of step back and think. And sometimes, look, I've made mistakes. There was a story where I had casually mentioned that I had seen some memes, some posts of people that took ivermectin that crapped themselves. Turns out that was a troll. And I'm being honest about that because sometimes that stuff happens and that the sensationalism kind of gets to you a little bit. And you think, well, obviously, right? Are people crapping themselves to ivermectin? Not as many as you would believe. Are people flooding the emergency rooms by taking horsey paste? Not as many as you'd think. And so, again, thousands of people, I don't think thousands of people are rushing to feed stores. Hundreds, probably. Handful, could be. And I have showed you that there are places that have certainly run out or run low on their stock of people picking this up. And so it is a phenomenon that is actually happening. That said, there is disinformation from this story, and I want to get to more of that. So now, as the story is gaining traction, the large hospital that McEllier was affiliated with put out a statement on its homepage denying the doctor's claim, saying that Dr. McEllier has not worked at our Salisal location in over 2 months. NHS Sequoia has not treated any patients due to complications related to taking ivermectin. This includes not treating any patients for ivermectin overdose. All patients who have visited our emergency rooms have received medical attention as appropriate. our hospital has not had to turn away any patients seeking emergency care. All right. So they added, we want to reassure our community that our staff is working hard to provide quality health care to all patients. We appreciate the opportunity to clarify this issue. As always, we value our community support. And as the Columbia Journalism Review points out, many noted that in his original interview with KFOR, Misleading hadn't actually said anything about ivermectin cases crowding out other patients, but that the initial story and subsequent coverage had linked separate comments about ivermectin overdoses and scarce beds. So now they link two things that are sort of tangentially related, but again, there's no causation here, right? There's correlation, and so there is a shortage of beds in places that are being hit hard by the Delta variant, and that is due not to ivermectin overdoses, but actually to unvaccinated COVID-19 patients. And so 97% of all COVID hospitalizations are among the unvaccinated. And so there are hospitals in Florida that have reached near capacity in their ICUs. They're filled to the brim with COVID patients. Many of these medical professionals are at their breaking point. And so understand that those two things are related to COVID-19, but again, one is not the cause of the other. The hospitals are not filled with with people taking ivermectin and overdosing on it and having to go to the hospital. So now there are numbers, and I'm going to give you those numbers, because there are cases of people taking ivermectin and ended up going to the hospital with poisoning. But they are very different from what's going on. Look, and by the way, there are also cases where non-COVID patients had to be turned away from hospitals because there are so many COVID patients that have clogged up the hospital system. It's a big, big problem, but it is not. That does not mean because people have overdosed on ivermectin. In fact, the numbers here, the New York Daily News on September 2nd published a story where the managing director of the Oklahoma Center for Poison and Drug Information, Scott Schaefer, had said that since the beginning of May, they've received reports of 11 people being exposed to ivermectin. So now that's 11 reports of overdoses of ivermectin in the entire state. So now, don't go and take the horsey paste, okay? Don't do that, because it actually doesn't help with COVID-19. But understand that 11 cases of ivermectin poisoning is a far cry from the number of actual unvaccinated patients, COVID patients, that are taking up hospital space. And so I think that's important to point out. And I also think it's important for people who reported falsely in the story to put out a correction. Now, Rolling Stone did just that. They put out a correction, an update to their article, citing the information it cast down in the story. But as of right now, The Guardian has not issued a retraction or updated their article. And of course, the tweet promoting Rachel Maddow's story happens to still be live. The KFOR article has not been updated either. So there's another additional note here from the Columbia Journalism Review. They write, the statement that there had been no ivermectin cases came from a single Oklahoma hospital. And while Misleading wasn't working at the particular hospital when he made his comments, he had worked there previously and works for an agency that provides services to various local hospitals, writes CJR's Matthew Ingram. Misleading also stated in his original interview that there had been some ivermectin overdose cases in the hospitals he was familiar with, although he didn't say these cases had taken ICU beds away from other patients. He has since told another Oklahoma news outlet that he had been misquoted by KFOR. So this is an example of the false cause fallacy. They presumed that a real or perceived relationship between these things meant that one is the cause of the other. Oh, there's so many people that are overdosing on the horsey paste, and that's why the hospitals are crowded. No. Again, hospitals are crowded because people won't get vaccinated and would rather take ivermectin instead. They take the ivermectin, even in safe doses, and they get COVID anyway. And then some of them get hospitalized as a result of the COVID. So yes, there is relation here, but again, it's the common cause here is COVID-19. And so now look, the FDA says that ivermectin has not been approved for the use of treating and preventing COVID-19 in humans. Ivermectin tablets are approved for humans at very specific doses for some parasitic worms, and there are topical formulations for head lice and skin conditions like rosacea. Ivermectin is not an antiviral, and there is evidence that the level of ivermectin needed to kill COVID-19 in the human body would end up actually killing the host. So you would need to take an ungodly amount of it. And so, not good. So don't take the horsey paste or the human version for COVID-19. It's just not effective for that. Okay? I'm trying to make a good comparison. It's like jabbing yourself with insulin for having a toe that hurts. Those two things, not really related. I mean, especially if you stubbed your toe. Okay, that's not going to be effective. Yes, the insulin is effective if you're a diabetic. All right. And yes, the ibuprofen is effective when it comes to actual pain. And so, again, if you stub your toe, take an ibuprofen. If you want to prevent COVID-19, you get a vaccine. That's how that works. And so, look, get the vaccine. And media, do a better job. Okay? It's tough enough to get people to believe in facts and to trust media when they do this, when they go overboard on some of these stories. And again, I've done it too. And so I'm not, I'm not really living in a glass house because I'm also throwing house at, I'm throwing glass at or rock at my own house to try to actually make that analogy. And so, look, do better. And I'm not saying, and by the way, I'm not saying they're less trustworthy than certain podcasters and media figures. No. The media is more trustworthy than them on issues of factual information. And when it comes down to it, this is a fairly small oversight and not nearly as bad as promoting drugs that don't work for that specific thing. But it does hurt credibility and makes the job of actually getting real factual information out a lot more difficult, because then people will get confused and then they don't believe it. We saw the same thing with the masks. There were people out there in the government at the time that were saying, "Oh no, we don't need masks. Yeah, no, it's fine." And some of them were even doing it in an effort to try to save them from medical personnel. But then later on recommended masks, and now there's this confusion about masks. And so the whole point is media needs to be more careful in making sure that they don't fall victim to doing their own fake news, because it really is important to try to get things right. And, if you do get it wrong, just correct yourself. That's all. If you enjoyed this video, please give us a like and share with your friends. You can subscribe and help out the channel by becoming a patron. It's patreon.com/Jeff Waldorf, or you can become a channel member as well by hitting the join button below.